And his paper was published in 1978, has been cited thousands of
training program for diabetes anywhere in the world. We have currently trained over 15,000 physicians in over 78 cities in India. Similarly, we also have a certificate course in gestational diabetes and diabetic retinopathy. In collaboration with the Indian Diabetes Educators Association, we run the National Diabetes Educators Program. Again, I think something like 5,000 or 6,000 educators across 80.
16. In April 2017, he received the Tamil Semmal Award from the Tamil Nadu government.
And even a department of precision diabetes, which was inaugurated with the support of Dr. Colin Palmer and colleagues, where monogenic diabetes testing, about which you've heard quite a bit already in this meeting and we're going to hear more, is now being routinely done. And what I'd like to announce today is that it just got cheaper from today. Literally from today, so we've slashed the prices of testing and made it much more affordable, and we hope that as the days pass, we'll be able to further slash the costs of monogenic diabetes testing, and we are officially recognized as the ICMR Center for Monogenic Diabetes Center. We have clearly a number of firsts. We are the first ISO 9000 certified center. We are the first center in Asia to do grading of retinal photographs, which my wife set up. We are the first center in Asia to introduce electronic records. The first to introduce a high fiber white rice, which I think is the first in the world. We have a patent on it now. The first and the only center in India which does glycemic testing of foods for industry and for others. And as I said, the first precision diabetes center in the country. We have been consistently ranked as the #1 center, and this is just a partial list. The Week magazine for the last 5 years in a row has nominated us as the best standalone diabetes center in India. The Healthcare Summit, again as the best diabetes center in India in 2015. ICICI Lombard and CNBC TV in 2016 rated us as the best single specialty center in diabetes care. The OPPI recognized us as the best diabetes center. The Times of India last year voted us as the best diabetes center in India, and the Times of India again voted us, and we had 1 star. We rapidly grew, and then we bought the land adjacent to the hospital and built a building there. And I remember Professor Ganguly inaugurating that building. He didn't even know that such a building was coming up. He was the Director General of ICMR, and he said, "How did this happen?" I said, "We spent every rupee we had from the hospital to put this." And he said, "Why are you doing this? You should be asking us for money." And so from there, we became an ICMR Advanced Center. Today, MDRF is in 5 locations and we're still growing. The big one is at Siruseri, which is a 6.5 acre campus, 40,000 square feet, where all our basic science is done. It's about an hour's drive from here. We also have an epidemiology unit, a gestational diabetes unit, clinical trials unit, and a food and nutrition research unit. We are recognized by various universities in India and abroad. We are recognized with ICMR, DST, DBT, and several universities work with us for PhD programs. The MGR Medical University, the Madras University, the Deakin University, and now the Warwick University in UK, and many others probably done. In 2008, the WHO, actually they came to us and said, "Why aren't you a WHO collaborating center?" So then they said, "Just put in an application, we'll give it to you." And then they made us a WHO collaborating center. In 2016, ICMR, which had already recognized us as an advanced center, now made us a permanent ICMR center for advanced research on diabetes. The IDF had already recognized us earlier, and this was renewed at Abu Dhabi with 2 separate recognitions, as an IDF Center of Excellence in Diabetes Care and as an IDF Center of Education. We always felt that we have to involve ourselves in capacity building. It's not enough if we just run our own centers, we have to train people. I'm not going through the entire list, but we offer courses for physicians, doctors, diabetologists, postdoctoral fellowships, eye disorders, retinopathy, education, laboratory technology. It's a mini university for diabetes, and we're hoping one day we'll actually become a university for diabetes, the first of its kind in the world. We also run Pan-India courses, and this is done with the Public Health Foundation of India, and the Certificate Course in Evidence-Based Diabetes Management, or CCBDM, about which a full article was written in the Lancet, is actually the largest training program for diabetes anywhere in the world. We have currently trained over 15,000 physicians in over 78 cities in India. Similarly, we also have a certificate course in gestational diabetes and diabetic retinopathy. In collaboration with the Indian Diabetes Educators Association, we run the National Diabetes Educators Program. Again, I think something like 5,000 or 6,000 educators across 80 or 90 cities in the country have been trained. And recently, with the Deakin University, Melbourne, we run India's first diabetes nurse educators course. This is the healthcare products company which I talked about. We started first with the research, and then we stumbled upon this high fiber rice quite fortuitously, and then we started developing the brown rice and the brown rice flakes, and now we have a whole bouquet of health products which we are developing and marketing. The Atlas of Indian Foods is the first and only one in the world which talks about cooked Indian foods. If you want to know what a puri contains, or what a chapati contains, or what your dal contains, or what your rasagulla contains, there's no source where you can go. You can't Google it, so we had to actually cook it and then find it. It took 7 years to produce this book. Low cost footwear is something which many of you also do, but this is something which we also do. Finally, a few words about charity. I mentioned that this is the first organization that we set up, and over the years, working by ourselves and now increasingly working with the Satya Sai organization, which provides a platform, because as you know, Baba's organization, everything has to be done free. We cannot charge one single rupee for anything that we do, whether it's education or healthcare or anything. Not even a registration fee of 1 rupee can be collected. So working with that, we